Hello everyone and welcome. On the occasion of World Lung Cancer Day, we are here to talk about a disease that's often misunderstood and unfortunately often detected late because its early symptoms seem so common. Joining me today is Dr. Jitesh Rajpurohit, a surgical oncologist at SSO Cancer Hospital whose expertise is thoracic and lung cancer. Doctor, you've probably seen many patients who come in thinking they have just a bad cough but only to discover it was something much more serious. Is there a patient story that has stayed with you, and what do you think all of us can learn from it?
This is the commonest scenario. We often see patients who come to us with a chronic cough which lasts more than a month. They have seen a family physician or they have tried over-the-counter medications. And subsequently, when they go for a routine scan, they find out they have a lung cancer. So there's one patient which comes to my mind who in the post-COVID era, he came to us with a chronic cough which was more than a month old. He has tried the medication without any benefit. And when he went for a routine scan, he was found to have a stage 1 lung cancer. We took him up for the surgery. He underwent a bad lobectomy and final report came out as stage 1 lung cancer. So this patient was treated with surgery itself. No further medication was required. He does come to us for follow-up every 6 monthly and he is disease-free since then. So the important point is that the patient who have a chronic cough which lasts for more than 2 or 3 weeks and they have tried medication and there has been no benefit, you should see a family physician or a pulmonologist and get yourself screened for any chances of having a lung cancer.
That's such an important perspective, doctor. It really reminds us how easy it is to dismiss symptoms that don't seem serious. So the next question I would like to ask to you, doctor, is that one thing we hear all the time is I've never smoked, so lung cancer can't happen to me. What is your perspective on that?
So this is the commonest myth that if I've never smoked, I may never get a lung cancer. Smoking is the most important factor for lung cancer, but it is not the only risk factor. There are other risk factors which may lead to a lung cancer, like if you are exposed to environmental pollution, if you are having occupational hazards like chemical industries, this patient may get lung cancer. If you have a household exposure to radon, or if you have a family history of lung cancer, or if you have a chronic history of COPD. These all other risk factors other than smoking which may lead to a lung cancer. So the smoking is the important factor but not the only factor. If you have never smoked, you may still get a lung cancer, which is more common in females where they have never had a history of smoking, but they still do get lung cancer.
So I think that's a myth a lot people still believe. So it's great to hear that it's clarified. So let's imagine someone has had a bad cough for 3 or 4 weeks. They have tried cough syrups, antibiotics, maybe even home remedies, but they keep delaying a doctor's visit because they think it'll eventually get better. At what point would you say it's time to stop waiting and get this checked?
Yes, this is a common scenario where a patient has been having a cough for more than 2 or 3 weeks. They have tried home-based medication, over-the-counter medication, even the antibiotics, but they have not got the benefit of these medications. If you have a cough for more than 3 weeks, or if the cough has hemoptysis, that is blood in your sputum or cough, or if you have a weight loss. These are the common scenarios where you should see a family physician or a pulmonologist and get yourself evaluated for lung cancer. Other than this, there are chances where you may have an advanced disease, like if you have convulsion, if there is a brain mets, you may have convulsions. So this is one scenario where you should suspect yourself as having a lung cancer. Other than that, bone pain is there, facial edema and joint pains. All these are the other risk factors where you may get a lung cancer.
That's really practical advice and hopefully something our viewers will remember. So many people still associate lung cancer with fear and hopelessness, but treatment has come a long way over the years. So doctor, if you were speaking directly to someone who has just been diagnosed today, what would you want them to know?
So, lung cancer is one disease where we have seen a lot of progress in the last decade. Coming from the previous era where the surgery was the only treatment, where it used to be a long incision, big thoracic surgery, and for removing a small tumor. We have come a far away. Now the surgeries are minimally invasive. We do VATS and robotic surgeries. Other than the surgery part, there has been a progress in the medical oncology part also. Now, previously we used to treat every patient with a chemotherapy, but in the present area, we have a targeted therapy, immunotherapies are available for the treatment. Even if the patient has been diagnosed with a stage 4 malignancy, they can expect a long-term survival with this medication itself. So definitely there has been a tremendous progress in the treatment of lung cancer in the last decade. Patient can expect the survival in years even if they are diagnosed in stage 4 malignancy.
So, doctor, before closing up, if our audience wants to remember just one thing about lung cancer from this conversation, what would you want it to be?
So I would like to tell everybody that lung cancer is not the end of life. Today's era, we have a lot of treatment options available. If you're diagnosed at any point of your stage, like from stage 1 to stage 4, we have multiple treatment options available. If you're diagnosed with early stage lung cancer, that is the best scenario. Early detection definitely saves lives and gives you a normal life ahead. If you're diagnosed with the early stage lung cancer, you can be completely cured with all these treatment option modalities. If you're diagnosed with the later stage, we have still a lot of options available in stage 4 malignancies. As I have told earlier that there has been tremendous progress in the targeted therapy, chemotherapy and immunotherapy. With these treatment modalities, we can expect a long-term survival. The best scenario would be getting diagnosed at an early stage. If you have any symptoms which gives you a sign of lung cancer, like cough which lasts for more than 2 to 3 weeks, no relief with the medications, or if there is any signs of weight loss or hemoptysis, you should see a family physician, get yourself evaluated for lung cancer and get yourself treated with an expert.
Thank you so much, Dr. Jitesh, for taking this time to share your insights with us today. And thank you everyone for watching. If this conversation helped clear even one misconception or encouraged someone to take persistent symptoms seriously, we have achieved our goal. Take care, stay aware, and we'll see you in our next conversation. Thank you.